In this segment of Health Matters, we're sitting down with Dr. Guttentag from the Department of Orthopedic Surgery here at Florida Medical Clinic. Dr. Guttentag specializes in sports medicine and knee and shoulder reconstruction. He is also the head team physician for one of Tampa Bay's most popular sports teams. Dr. Guttentag, you're involved with the Lightning. Tell us your role with the team.
I've been involved with the Tampa Bay Lightning since 2002. I'm the medical director and head physician for the team.
What kind of injuries do you see most often?
There's crazy types of things. You can imagine from the puck hitting somebody, it doesn't really bode well for people. So a lot of broken bones, a lot of shoulder injuries, a lot of knee injuries. The guys get a lot of cuts to their face.
Right.
So it's pretty much a big variety.
Wow. So rewind about a year. Major injury to Stamkos. You were the man who said, yes, you can go back, but only when I say you can. What was that like for you?
Oh, that was an interesting situation because we had to balance the interest for the team versus Steve's interest, which obviously all the players want to play as quickly as possible, but as the medical team has to determine what's best for him for his long-term career goals, but then you had the whole nation of Canada wanting him to play in the Olympics. So it was a somewhat stressful decision, but I think in the long run, everybody was very happy with how it all turned out.
All right. Now, your full-time position here with Florida Medical Clinic, tell us what you do here.
Well, I'm the orthopedic surgeon. My specialty is knee and shoulder reconstruction and sports medicine. So I take care of athletes of all ages, ACL injuries, rotator cuff injuries, cartilage repair procedures. And then also a big part of my practice is joint replacement, total shoulder replacement, total knee replacement.
And talk about this procedure that you're doing that only one other physician in Florida does, and you do it right here in Tampa Bay.
It's interesting. We've done tremendously well with the traditional knee replacement as far as range of motion and pain relief goes. And as well as function as well. But there's a small subset of patients that come in and they complain that although their pain's better and their function is much better since the surgery, their knee feels artificial or mechanical. And one of the reasons for that is that with traditional total knee replacement, we have to take out the major ligaments in the knee. Most of the time it's the ACL, and sometimes it's both the ACL and the PCL. And we have to replace it with a mechanical device, and it's really the plastic. This is a traditional knee replacement, and you can see there's the PCL, which is still intact, but the ACL is removed. And now we have to put this piece of plastic in to make up for that ligament that we've taken out. So it's more of a mechanical knee. With the release of this Biomet Vanguard XP, it's a cruciate retaining knee. So instead of taking out perfectly healthy ligaments that could function for the patient, we're preserving them. And this is the only knee on the market that allows us to do that. And what we found is that the recovery is a lot quicker, the pain post-operatively is less, and they don't complain. They say that the knee feels like a natural knee. The stability is there, the ligaments are there, and it functions much more like their normal knee.
Who is the prime candidate for a surgery like this? Anytime
new technology comes out, we try to gear it to the more aggressive patient, mostly because it's more expensive. So right now, Medicare probably will not pay for this knee because it's more expensive. It's really geared for the kind of the old athlete, the 40-year-old to the 60-year-old that has had meniscus injuries, ligament injuries, although they have to have their ACL and PCL intact. But anyone has arthritis that's very active that wants to continue playing tennis, golf, and have their knee function a little bit higher than a routine traditional knee replacement, they would be the perfect candidate.
So the advantage to this surgery over others is you're keeping more of your God-given body parts.
Right. The ligaments are critical to maintain the stability of the knee, and it gives feedback to your brain as to where your knee is in space. So there's this thing called proprioception, so where you know where your body part is without having to look at your knee, you know where your leg is in position. So by having these ligaments intact, you're getting that feedback, so it feels normal, doesn't click and clunk like a traditional knee replacement. The range of motion is usually a lot better. And the recovery, the interesting thing is I didn't expect the recovery to be as quick and have as much, having less pain than with the traditional knee replacement.
Wow. How were you chosen as a physician to learn how to do this?
Well, I do an awful lot of total knees. I probably do 400 total knees a year. And Biomet is the company that I've used for the last 20 years since I've been in practice. And you know, I think it's one of the top companies in the country. They have things that their company has that other companies don't. You can see that the plastic is yellow. That's because it's impregnated with vitamin E. And vitamin E, as you know, is an antioxidant, so the wear patterns are a lot better. So the way they inject the vitamin E is very, very good. So I've been very loyal to this company. So because of the number that I do, they handpick the surgeons that they want in particular areas. Obviously, they want someone that has a busy practice, that does a lot of these, so that they can start telling people about the benefits of the procedure. And I've been fortunate enough to be selected, and the first few patients that we've done have been very positive.
Do you see yourself doing this in the future on maybe a Lightning player? Is this the type of surgery they might need?
Hopefully not, because again, am I doing this on a Lightning player, their career is probably going to be over. You know, it's not made for high-level sports, but certainly for someone that's played hockey in the past and has had some meniscus injuries and cartilage injuries, and they have arthritis, then this would be a terrific procedure for them.
We're very blessed to have doctors like you in the world to go to at Florida Medical Clinic. However, advice for someone who maybe feels some pain in their joints, how do you protect your joints? What's your best advice?
Well, really the best thing is to maintain a healthy weight. I think that the epidemic of obesity in this country is really leading towards a lot of increased need for knee replacements.
Yeah.
Low impact exercise, even if you have an arthritic joint, if you avoid running and just do low impact exercises like walking, bike riding, swimming, are all terrific ways to prolong the life of your knee and to hopefully put off knee replacement.
After a replacement like this, you mentioned it was a very quick recovery, quicker than other surgeries. Are you able to go back to doing the same things you did prior to the surgery? Not that you may recommend that, but...
Well, that's exactly well put. I mean, I can't say to go out and run on this, but I actually think because all the ligaments are functioning, it's a stress shielding device, meaning that it's not getting the same impact that a traditional total knee would.
Right.
And although we don't recommend doing it, I think that if someone went out and tried to run on it, they would be able to. And in fact, there's really no literature saying that you can't run on these devices.
All right. Last question. Predictions for the Lightning season?
Stanley Cup all the way.
All right. Thank you, Doctor.
Thank you.